A warm welcome to your Barbados Today Evening News Update for Thursday, May 6. There is no need to panic. That's the assurance from the island's top health officials as they confirm that investigations are underway into COVID-19 exposures at the St. George Primary School and the Princess Margaret Secondary School. Chief Medical Officer Dr. Kenneth George told the country there was one positive case at Princess Margaret and public health measures have been activated.
There was a single exposure involving a student from the 5 upper 1 and 5 upper 2, and based on that information we have identified a total of 58 contacts. 2 of those contacts are what we describe as very close contacts, and those persons are in quarantine and they will be tested today. The plan is to test all students in the upper 1 and upper 2 classes. And in addition to that, a list of teachers were provided by the school so that we have a complete picture as to where we are at the school. These cases are linked. As I said, there are 2 families, 2 extended families, which we continue to look at. And in that family group, we have identified several persons who have been positive, and those persons are being managed at Harrison's Point.
In the case of St. George Primary, one student has been tested and the results are negative.
We are awaiting to perform a second test as early as the 8th of May. The students at that school are doing homeschooling, online schooling, and the Ministry of Education has been very cooperative in sharing the lists of students and teachers at that school. If needs be, we will certainly institute much more contact tracing at this point.
Health Minister Lieutenant Colonel Jeffrey Bossett says the situation is well under control and there's no need for further action at schools or in the country at this time.
We are satisfied that based on the discussions that we've had, that there's some areas that were identified by the unions that we believe we can certainly try to assist the schools and the Ministry of Education with improving. We understand clearly that there will be anxieties, there will be concerns, and even fears by members of staff and parents. But we want to assure you that at this point in time, there's absolutely no need to panic, and that we will continue in the same mode that we've been going for the last few weeks. And if anything goes against what we are anticipating, then we would be prepared to take any further action that is required. But at this point in time, there is no need for any additional measures or actions at the schools or certainly in the country.
Acting Chief Education Officer Joy Adamson says the ministry is closely monitoring the impact on the students at the 2 schools.
We know that some students will not be in a frame of mind to continue some of their practical exams, but that is something that we would have to monitor, say, next week. The classes tomorrow will be suspended, and we will be monitoring those students. Remember, they're the exam students for the CXC, so they have the option to defer if they need to do that. So that's something that we will be looking at. The other students at the St. George, they're continuing their classes, so technically we don't think at this time that that should affect them.
Meanwhile, new positive COVID cases have emerged at the psychiatric hospital where a cluster was discovered late last month.
We continue to investigate the psychiatric hospital. As I indicated, there are 50 individuals. Yesterday afternoon, we indicated to the public of Barbados that this was confined to a ward. But now there is one single case that has popped up on another ward. And what we have done is we have found 30 staff members across the whole plant who believe that they may have been exposed in some way, and we made a decision this afternoon that all those individuals will be placed in quarantine at a hotel in Barbados. So therefore, we continue to work with the psychiatric hospital to make sure that the issues there remain contained. At this point in time, the outbreak seems to be mainly with clients and only a few staff members. And in closing, I will just let the public know that there has been some reluctance on the part of some members of staff at the psychiatric hospital not to test. And I'm just imploring you that if we are to get to the true bottom of the situation in psychiatric hospital, we need the cooperation of all staff.
In other news, Barbados' current high debt level is not as a result of borrowing. Word of this from Minister in the Ministry of Economic Affairs and Investment, Marsha Caddle, as she addressed the 17th Annual Royal Fidelity Economic Outlook Conference, which was held online under the theme Global Digital Disruption, Threat or Opportunity. The economist pointed out that government's borrowing only accounted for about 5% of the current debt stock, which stands at around 152.5% of the gross domestic product.
After Barbados finalized our domestic and external debt restructuring, debt including arrears went from 176% to 117% of GDP. The figure at the end of March 2021 was 153%, but why? Only 5% of that accounts for actual borrowing, and nearly 31% is because of the shrinkage in the economy. In other words, since your GDP, your denominator is much smaller, your debt as a percentage of GDP appears much higher.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional news, in Trinidad and Tobago, health authorities warn that COVID infections are rising, hospital beds are running out, and young people without underlying health conditions are dying from the virus.
The Ministry of Health warns that at the current rate of infection, the remaining 542 hospital beds in the parallel healthcare system will soon be occupied.
And if all things are equal, meaning that our staff continues at the numbers that they are continuing, that we have all the equipment in place, supportive and otherwise, that our ambulance system is not overwhelmed, which we were close to, I must say, on Thursday night, we will have only 226 spaces available, which gives us 7 days to full occupancy.
As of this morning, there were 316 COVID patients in hospital, with 42 pending admission. This, as the number of COVID cases reported in a 24-hour period continues to hit triple digits, and this month is projected to end with astronomical figures.
If we just look at the projections of those active cases, we see where that projection runs up to getting towards 10,000 people by the end of May, which is not a place you want to be.
The incidence of COVID death has also spiked, with May recording 16 deaths in the first 4 days. There were 6 deaths recorded on Tuesday alone, taking the death toll to 185.
Further afield, British voters headed to the polls today to elect new mayors in London and Manchester, new members to the Scottish and Welsh parliaments, and hundreds of local councillors.
This is the first opportunity that British voters have had to express themselves since the general election of 2019. It was a resounding victory for Boris Johnson's Conservatives. Now they can show how they're feeling about the handling of Brexit and the pandemic. There's, of course, a whole range of different votes and different issues at stake, whether it's which council candidate will fix your nearby potholes, which mayoral candidate has the best plan to revitalise your city, all the way up to which of the parties running in the Scottish and Welsh elections represent the best choice for the future of those countries. These are local issues, but national parties are watching to see how voters are feeling. A bad result for either of the big two, the Conservatives and Labour, could raise questions about their leadership and future direction. especially in the one vote that's happening for the National Parliament, a by-election in the hotly contested seat of Hartlepool. But for the rest of the world, the greatest curiosity will be about Scotland. Although this is a parliamentary election to choose the next government that will take office in Edinburgh, it's being fought as a quasi-referendum on independence, or indeed on whether another independence referendum should be held. The pandemic has delayed these votes and will delay the results too. We'll be waiting until Monday for some, and everyone is encouraged, if possible, to bring their own pencil to mark their ballots.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.